If you are missing a tooth and want to have a tooth replaced, oftentimes a dental implant is a good option, and I do that for a lot of patients. Basically, to think about an implant correctly, think of the implant itself as a screw. And basically what happens is the dentist makes a little hole into the jawbone and screws an implant in. The screw or the implant is placed into the bone, and it's allowed to sit there and heal for anywhere from 3 to 4 months typically, until it gets rock solid in the bone. And then we can go back in there and attach things to these screws and eventually put a crown on there to replace that tooth. In situations where the patient doesn't have any teeth and they want like a denture to be more stable and more functional, we can place multiple implants into a jawbone and then attach a denture to that to make that denture fit better. A lot of times we'll do this on a lower denture that doesn't fit very well for a patient and is flopping around a lot and causing the patient a lot of difficulty in chewing. If we can attach a couple implants to the lower jawbone and then attach that to the denture, it can transform their ability to chew. And it's a great feeling for that patient, and I really love doing that. Dentures are always a difficult thing for most dentists, because understanding it from a dentist's point of view, the way we are taught in dental school and as trained professionals is that it's the worst thing you can do for a patient, because you're removing all the teeth for a patient and giving them a piece of plastic to replace their natural teeth, and it can never be as good as their natural teeth. With that said, there are cases where the situation for the patient is clinically not good if they try to keep their teeth. It's not a sustainable or viable situation for them to keep their teeth due to periodontal disease or tooth decay, or maybe a traumatic accident they had that caused their teeth to be mutilated. And in that case, the best thing you can do for a patient is to remove their diseased teeth and give them a denture. In that case, it's very important, from my perspective, to give them something that really gives them their dignity back. A lot of times with denture patients, they'll come in with their teeth, ready to fall out of their jaw, and they're just really embarrassed about their smile, and it's been a source of psychological embarrassment and a really crippling psychological experience for them for a lot of years. They feel ashamed of themselves, and if you can remove these bad teeth and give them a denture, and all of a sudden give them basically a facelift and a smile lift and something that completely transforms the way they look, that is what I look for when I make dentures a lot of times on patients and get that result, I'll be honest with you. And that's a great thing for patients. It's one of the most satisfying things I can do for patients, even though that I know that making a denture is not the most ideal situation. We'd always rather try to save teeth. In some cases you just can't do it, or the patient just can't afford the treatment that it would be to save the teeth, with implants and bridges that can run into tens of thousands of dollars. In that case, I'm more than happy to do a denture for a patient and make their life better for them immediately. And a lot of times I can get that result, and it's very satisfying. Crowns and bridges are a part of every general dentist restorative practice. A crown is basically a cap that goes over the tooth. A lot of times a tooth is broken down so much due to decay or being filled over and over and over again, where you just can't fill the tooth anymore. If you try, it's going to be a tooth that's going to shatter and break at some point. So you really need to protect that tooth with a crown, which covers and splints and protects the tooth. So that's what we're looking to do with the crown, is to give the tooth some long-term restorability and make sure that it's going to be a tooth that doesn't give them problems down the road. If you try to get away without crowning a tooth, a lot of times the tooth will break and end up needing a root canal or break in a way that makes it not restorable, and you end up having to remove the tooth. So a lot of times I'll recommend crowns on patients to prevent further, more expensive, more involved treatment later. Sometimes when you actually lost a tooth and you want to replace that tooth, and you want to do it in a way that's quick and looks good and it's fixed, we can place a bridge in there, which basically replaces the missing tooth, using the teeth in front and behind the missing space. It's a great way to give them a full bite with full function back in that area. It takes only a few weeks to do it. The other option is to replace that missing tooth with an implant. I prefer to place implants over bridges like most dentists do, because it doesn't involve preparing the teeth on either side of the missing space, but sometimes a bridge is better because it's quicker for the patient and they're just not good candidates for implants. So these are the kind of concepts and treatment options that I like to discuss with patients thoroughly and take my time with them and make sure that they understand all the issues and the pros and cons involved with each decision, because it's an expensive decision, let's face it. This is thousands of dollars we're talking about, and this needs to be thought about and understood very carefully before you make this decision, because it's a decision that's going to last for a long time. And when I place a bridge for a patient or place an implant and restore with a crown, I tell the patient, I expect this to last at least 10 years, and really I would be surprised if it lasted. I wouldn't be surprised if it lasted much longer than that. That's the goal. The goal is to never have to redo it again. I can't make those kind of guarantees, and neither can really any dentist with that kind of work. But my philosophy is to make the kind of restorations for patients that I can stand behind, that I believe in, and that I know will have a good chance of lasting a long, long time and making the patients happy with how they function and how they look. My office is located in Eustis, Florida. I'm in the Eustis Square Shopping Center where the Tractor Supply and the Bell's Outlet and the Save-A-Lot stores are. And our office hours are Monday through Thursday, 9 to 5, lunch from 12 to 1. My name is Dr. Eric Meeker. I look forward to treating you and your family.